Welcome to Alzheimer Speaks Radio. I'm your host, Lori LeBay, and I'm so excited that you're joining us today. We are going to have a fascinating conversation as usual as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
Here we go. What you think about, you will bring about dementia change. We will.
Hi, everyone. It's Lori LeBay with Alzheimer Speaks, and I'm thrilled you can join us today. We are going to have a fantastic topic. We're talking about caring beyond the diagnosis, which is so critical. We're going to talk about music, incontinence, and whole person wellness. I've had these three ladies with us before, and they are marvelous. I just haven't had them all together. So let's go ahead and pull back the curtain and introduce you to them. Well, ladies, I am so excited to have you with us. We've had each of you on before, but not together as a team. So this is going to be kind of a fun, exciting time. I think it's so important to have this conversation that we're having today about caring beyond the diagnosis. And I love the idea of pulling in the music and the incontinence and just the whole person wellness, because to me, life ain't much if we're not looking at the whole big picture. We're missing a lot there. So I'm going to have each of you introduce yourselves. And Deanna, I'm going to have you go first, if you don't mind.
Sure. Fantastic. Well, thank you, Lori, honestly, for the opportunity. I feel like I'm in wonderful company today with Dr. Laird and Alexis, too. So really a treat to be here. I'm Deanna Vigliotta, the National Sales Manager for TZMO USA, the Seni brand, high-performing adult incontinence products.
Wonderful. Thank you. And Dr. Laird, you want to introduce yourself?
Sure, absolutely. Thanks, Lori. I'm Dr. Rosemary Laird. I'm a geriatrician and memory care specialist, and I've been helping patients and families facing Alzheimer's disease for about 25 or 30 years now. And just really looking forward to this conversation. I've actually not been affected personally by this illness in my immediate family, but certainly have lived with many families from my patients and family caregivers, and have a real strong belief that their care needs to be uniquely special. And so I'm certainly looking forward to today's conversation.
Wonderful. Thank you. And Alexis, you want to introduce yourself?
Sure. And thank you so much, Lori, for having us on today. It's always an honor and pleasure to be with you. My name is Alexis Baker. I'm the founder and owner of Bridgetown Music Therapy, which I started in 2016. I am a board-certified music therapist of 12 years, and I've been so music therapists can work with all ages, all different types of settings. But for the past 9 years since I started my company, I've been focusing on serving the older adult population, specifically those living with dementia.
Wonderful. And have you been personally touched at all by dementia?
I have. So my grandmother had Alzheimer's disease, and she was diagnosed when I was pretty young. Didn't really understand it at the time, but as it progressed, I started to get a clearer picture of what this disease is, and she passed away when I was 16. So it was very impactful at that age, and I would say she was my first real exposure to dementia.
Thank you. And Deanna, I'm going to ask you the same question. Have you had any personal experiences with family and friends?
Yeah, unfortunately, the older I get, the more closer in my circles. But I did have an aunt on my dad's side who had Alzheimer's, and then even more recently, a friend of a friend that we would see a few times a year passed away from Alzheimer's. So just hearing more about it, as I say, unfortunately.
Yeah, it's hard not to be touched. And Dr. Laird, you're lucky, because there's very few people that I talk to that say that. And some people think it's the circle that I'm in, but I have a lot of other circles outside of my dementia world too, and it really is amazing how many people don't know what it is or how to deal with it or what to go for support? Do they just throw in the towel? How do they fight the fight? And that's what we're going to kind of talk about today. How do you maintain your sanity and have fun doing it when you're dealing with a chronic illness? So thank you. Well, Alexis, I'm going to go to you first, and I'm going to have you dive a little bit deeper into music therapy. You said, it's for all ages and stuff, but how does it work, especially for people living with Alzheimer's or some form of dementia?
That's a great question, and one I get all the time is, what exactly is music therapy? And then people are always curious about how I work with people living with dementia. So just a little about music therapy first, because it can kind of be this concept that everybody has their own idea about, but music therapy is a healthcare profession. It's a creative arts therapy as well. So we are trained to do assessments and treatment plans and all of that evaluation documentation that like a physical therapist would do, or an occupational therapist, so that we can really work on making progress in various areas. So we look at what we call the domains of functioning, and that's just looking at their cognitive abilities, physical, mental, emotional, spiritual, just the different areas that make up a whole person, and then how music can address their greatest needs. So how we can use actual music-based interventions to address their needs. And then we create goals and objectives to work on in the therapeutic setting. And music therapy does involve a credentialed professional. So a lot of people will say, oh, it's music therapy, because it can look like it. There's a lot of crossover with music entertainment, education, all of that. So music therapy is facilitated by a certified professional. I do want to note, we don't own the therapeutic part of music. So music is therapeutic in a myriad of ways, and it doesn't require a music therapist for it to be therapeutic for someone. So I just wanted to note that. And then with Alzheimer's disease specifically, we're looking at how we can engage them cognitively, physically, socially. With this disease, the brain is literally breaking down, and music is one of those approaches that engages the whole brain. So you can physiologically, you can look at different parts of the brain, the movement, speech, memory, all of those different areas, and music can touch all those different areas in the brain. So it's very powerful in that way. Music activates the feel-good centers of the brain, so the emotional, boosting mood and reducing anxiety. It can even help create new neural pathways in the brain. So as the brain is breaking down, music is often a workaround for accessing past memories, for social connection, for cognitive abilities, communication. So really there's no limit to how it can be used in a dementia care setting. Very powerful.
Well, I like that you mentioned that it is credentialed, because a lot of people think, oh, the entertainment's coming in and everyone's engaging. But I think it's because people see the change in people. They see an emotional kind of uplift a lot of times. And not that music can't make us sad. I know there's certain songs that I'm in the car going, oh, I got to turn the channel, because it'll hit me to some other type of memory too. So, I mean, there's that whole wide range. But I think it's something that we use every day, and we kind of take it for granted and don't really think about how powerful it is. And I know I've been amazed over the years. And if you want to tell people like how long you have to go to school for this, because this isn't just an in and out, easy little thing, to get credentialed to be a music therapist.
Yes, it is a entry-level bachelor's degree at this point. Mm-hmm. They've talked about making it a master's level, but it really is like a double major. So you're studying the whole music side of things, theory, ear training, oral skills. Like we have to have a basic competency level in piano, voice, guitar, and percussion. So a lot of people when they find out I'm a music therapist, they ask me, so are you a musician? Do you play music? And that always kind of baffles me, because it's like, well, yeah, of course I do. Like, I do music for work. There's the whole music side, and then there's the psychology, the application of therapeutic practice, all of that, and then it's just combined in school. So it's both art and science. We're diving into the whole music therapy process and how to really assess people and their needs. And then after completing all of the coursework, and you also do practicum sites throughout the training, but after completing the coursework, then you do a minimum 6-month full-time internship to get just over 1,000 hours in clinical training. So it's a total of 1,200 clinical training hours. And then you take the board certification exam, and that's like the culmination of everything.
I wanted people to understand that, because it's not, I mean, I can turn on the radio and I can pick somebody's favorite song, but I don't necessarily know the why that's making them happier or sad, or the rhythm. I mean, all of those things that you use. And I want to talk about that a little bit more, because how do you know? I mean, I know it's from your schooling, but how do you change their emotions and their behaviors and their physical being when you're with them? I've seen huge transformations in people's moods, from their head down and kind of sleeping to all of a sudden they're up, and their toes are wiggling, their hands are clapping, and they're trying to say words, and people are like, they don't talk, So how do you make all that magic happen? How do you focus in on an individual or a group?
Yeah, and I've seen that over and over where, especially with Alzheimer's disease, they tend to withdraw from the world around them. Their head is often down, and their world gets smaller and smaller, and they're essentially losing their personhood in a way. So music is such a powerful way to connect with them and engage them and help them re-engage with the world around them. A lot of it's trial and error. It's not like an exact science with music therapy, because especially when I'm going into a new client or group, I don't always know ahead of time what their favorite music is, but that is something to know, is that music is very preferential based. Everyone has their favorite music, and so it's important to find out what that is as quickly as possible, because that will be the most likely highest success rate in music therapy, is working with their favorite music. A general rule of thumb is that people's favorite music tends to be from the period of their life, from their childhood, teens, and through their 20s, because those are considered the most formative years. And especially in their teens and early 20s, they're forming their identity, and music has a lot to do with identity, and they're forming memory, a lot of really like life milestone memories as well, like school dances and meeting their loved one, meeting their spouse, getting married, graduating, all those major life stones that music is often present for. So there's that, but a lot of music therapy is based on observation and just observing their response in the moment and then adjusting. So if a song isn't working, there may be a reason for that. There may not be a reason for it that day. It could just be an off day. With dementia, every day is different for them. And as we all know, each person we meet with dementia is their own their own case. So you meet one person with dementia, you've met one person with dementia. I go in with a lot of tools and just activities ready to go. I'm just always ready to pivot in the moment. So it's a lot of in the moment response and observation.
So rhythm is important. I would think the tone of the music, because I know as I get older, certain tones I don't hear as well as I used to. And then, I see sometimes when people are singing, they'll have them join in on a chorus or something or you had mentioned you have tools. What types of things? I mean, when I've observed things, I've seen everything from pool noodles they're waving and balloons to actual music elements that they're playing with.
Yes. So in my practice as a music therapist, I focus a lot on singing, just getting them to engage in music through singing, movement to music, moving the body to music that engages the whole body, instrument play. Sometimes I've done songwriting, and it's just like a very simple form of it, like fill in the blank songwriting. So taking a familiar song and just rewriting it a bit with some fill in the blank options. So I bring instruments to sessions. I typically like handheld percussion instruments that are easy to play. I bring scarves for movement, various props. So from the outside, it may look simplistic, but there is a lot going on. And a lot of it is just built on my past experience. It's like I've learned a lot over the years of what generally works, what doesn't always work. But I always tell people something's always worth trying, because you never know if it will work or not. And then familiar music is really important too. So those like you mentioned, songs that have very like familiar choruses that people can join in on. But I also bring in song sheets so that they can have the lyrics in front of them.
Wonderful. How can caregivers or care partners incorporate music into their everyday routines? Even though they're not a therapist at heart, what do you suggest?
That's such a great question, and I love encouraging, empowering, equipping caregivers to incorporate music more into the day-to-day, because it's often one of those things that's so simple that people just forget about it. So it's kind of undervalued, underutilized a lot. A lot of times it's just very simple things like figure out what your loved one or care recipient's favorite songs are, and then learn them so that you know them yourself and you can use them throughout the day. So for example, transitions, going from the house to the car to leave for an appointment. Hey, so-and-so, let's sing a song while we're getting ready to go and walking out to the car. I know Deanna and I spoke about this with Incontinence and, personal care, shower time. I know a caregiver who used the same song every time for shower time because it would just help smooth out the task and just make it easier overall. Using music as a way to connect with your loved one, to take a break and pause and just enjoy music together. There's so many resources out there. Spotify and YouTube are great for creating playlists and just, looking up music really quickly and easily. And then just singing together or dancing together or, playing those instruments together. So using music as an enriching activity, sometimes just to fill time in the day as a positive, uplifting activity. But then other times using it truly as a tool in caregiving to help with transitions, to help with meal times, to help with personal care, all those important things in caregiving.
I know with my mom, we used the songs for the showers. And the administrator one time asked me when she was living in a nursing home, because I went in with some bathroom changes that I wanted done. And they're like, anything else? And I'm like, my topper of the cake would be get your staff to sing with them, because it just is so life-changing. If they would learn some of those songs while someone's in the shower, it just makes it go so much easier. And then I've seen companies and families use it for cues for, like you said, mealtime or something a little bit more quiet to get them ready for bed, or something maybe that has a little more pickup to get them moving. And then I've also heard when they're engaged in music, it can increase their brain activity, which, and I love that you mentioned about getting them more mobile, because that kind of, to me, ties into, Deanna, we're going to be talking about incontinence, about somebody even being able to get out of their chair to go to the bathroom, or be aware of their body, in terms of what is going on with it, or being able to assist if they need to be changed, and all of those types of things, I think is really critical. So thanks for all the information on music therapy. I'm just going to flip over and ask Dr. Laird and Deanna if they have anything they want to add. Looks like Dr. Laird does. I see that lean in.
Yes, yes. Well, first of all, thank you, Alexis. I paid attention in medical school and they didn't cover this. There's a lot that we can't put into medical school. So I assure you, there are many healthcare professionals who don't know this information. And so, Lori, this is really a terrific service you're doing for all of us. I learned a lot that I'm going to take into my day-to-day practice. I think, Alexis, a really interesting thing that I want to point out about everything I heard was that it did not include, although it's a therapy, it did not include the individual with Alzheimer's disease or dementia needing to do any cognitive work. And I think that's really important. We sometimes leave them out of the potential to be a recipient of therapy because we think they can't benefit. And I believe music therapy is a unique example where that isn't the case. And we do really need to get this into more people's knowledge for their, care choices. And so I really appreciate learning that aspect out of it. Alexis, thank you.
It's a great point. I like to call it a fun therapy, because sometimes people can be working really hard cognitively in a session, but without even knowing it, because they're just having fun and enjoying the music. And another thing I wanted to point out is I've had duos of a patient, someone living with dementia, and their caregiver in session. So it can also be for the caregiver to, to receive care themselves, and also as an opportunity to really connect with their loved one.
Love that.
That social engagement is so important to be able to pull people out. I mean, we hear about loneliness and isolation, and this is just like you said, a fun, easy way to kind of slide them in to a sense of community or a sense of belonging. I love too when you mentioned the dance, Alexis. I had a couple, they started their day and they ended their day with a dance. And the wife who was caring for the husband said, we don't touch that much anymore. And this is just really precious, and it's kind of old memory, and we can still dance and we can have that closeness. And I thought, how beautiful is that? She said it just charged her battery to be able to start in their day like that with music, and something that was always really important to them, but something that they don't feel like they can go out and dance in public anymore, and so they just do it privately. And I thought that was really cool to hear. Deanna, anything you wanted to add?
Yeah, well, it's interesting because Alexis just brought it up at the end of what I was going to say that I think is critical, is that it's good for all parties. And I think that's extremely important. If you're the caregiver, regardless if your loved one is in a home or in a community, mental well-being goes a long way for all parties. So if you can see your mom or dad or friend, whoever it is, your loved one, experiencing joy, and that gives you joy, then when you leave from the visit, it ripples out into a zillion different ways. You could go back to work and it could ripple out positively to your caregivers, to your colleagues, because you feel good. And vice versa, if you go and visit a loved one and you just sense that there's not joy there or quality of life there, you can leave and it's a completely different outcome. So I think it's a critical point that you bring up, that it's good for everyone. And I just want to say, Alexis, I've had the opportunity to speak with you a couple of times, and you just resonate fun too. And I think, honestly, the world needs more fun. And so to work in a field that can be tricky and challenging and kind of sometimes doom and gloom, it's what can we do to give joy and people quality of life. And so I think you just resonate that in what you're doing. So kudos.
Thank you.
It's such a powerful element. And Deanna, you brought up a good point about doing something that you both like, because it gets people out of being task oriented and focusing on the disease. I'm doing this again because of the disease. And that's what burns us out as care partners. Now it's back into a relationship type mode where everybody feels like they're getting something, and they can see the difference more easily with their loved one when they've stepped into it too, when they're not preoccupied with the other things that they have to do. They can see the relevance and the importance of what was missing, or that spark or that giggle or that smile that's been missing. Those are huge, huge factors to not only family, but staff too. When they see that, they're like shocked. We've seen that in various videos and stuff that have been out there. People are like, wow, they just come alive. And it's like, we all kind of do, this isn't just limited to them. It changes the chemistry, I think, in all of us. And I think that that's a really good point. Deanna, let's talk about incontinence, because this is a really difficult and sometimes very overlooked part of care. It's not something that, we just talk about openly. There's a lot of embarrassment and hiding of things. And you hear that from families and individuals and communities, the whole 9 yards. So why is it important for families and community to really address incontinence openly and comfortably?
Yeah. I eat, sleep, and breathe it, working with, Seni, but it really can be the root of so many different arms of different challenges that are out there. So to take away the stigma, if you have a person who has their faculties, if we can remove the stigma, they're more apt to go and enjoy some of the activities that a community may offer, or if they're living at home, they may feel more comfortable to go to that movie or theater or restaurant or shopping or whatever it is that brings them joy. So I always think from a social perspective, to reduce the risk of social isolation and depression and shame and all of that stuff, the further back that we can educate in years, so not when it is a problem, but ahead of the curve, we can take away a lot of that social stigma. And I think we are systemically, I think that is changing, which is a good thing. And then for other folks that, I think of it, if you are incontinent and let's say, for example, you're wearing an inferior product and you feel uncomfortable and you're constantly getting up at night and being changed or changing yourself, but it's broken sleep, it's uninterrupted. Well, the next morning, if you're not well rested physically, lack of uninterrupted, lack of good sleep, lack of restorative sleep can affect cell regeneration, hormone regulation, mood. Someone could say, "Oh, we're ready for breakfast." You think, "Ready for breakfast? I don't want breakfast. I'm tired," right? And then, "Oh, Alexis is coming in at 10. Music. I want to sleep." And you have a cycle that can go down an ugly path. Whereas um, if you are incontinent and you look at first improving any level that's possible to get you less incontinent, but then if you are incontinent at a certain level and you're wearing a good product, but you're able to sleep through the night uninterrupted, reap the benefit of restorative sleep, you wake up refreshed, happy, in a better mood naturally. And then, oh, breakfast is here. Good. I'm hungry. Now we add in nutrition, right? So it affects nutrition. Now we add in different social activities that are throughout the day. And then hopefully when you participate and have an active day, you break that cycle, right? And you're able to sleep. So it's all, in my opinion, it can be the root of a lot of different negative outcomes. But if managed properly, dignity can be given back to the person, independence, confidence, and then all of the other things, better nutrition. So I always say incontinence management can go negative or positive, but through education, we want to get more in the positive bucket.
Oh, absolutely. And I loved all those factors you pointed out because that is so true. If we don't get sleep, we pull back. If we don't feel comfortable, if we're worried we're going to leak or soil ourselves, or is it going to squeak or look bunchy on me? Are people going to tell? I mean, we have all of those dignity factors. And one of the things that I think that's going to get easier over time is, I think my daughter's in her mid-30s, but I remember even when she was pregnant, that all the girls, they just grab the incontinence products. They're like, you're not slowing me down. It's like, give them to me. And so I think that group is going to handle things much better, where our older generations were like, no, now I'm feeble, now I'm dependent, now I all these things I can't do, just like how nursing homes and senior communities used to be viewed. When I sold real estate, they were like, you're taking me out of here feet first, because I'm not going, because their impression was they didn't see any of the positives to it at all. And Seni does such a great job educating people of, this is about empowerment, this is about good health, this is about engagement on so many levels. It really is absolutely fantastic. And so if you go into, I don't care if it's a drugstore or online and you're searching, there's a lot of products, people are using them. So don't hold back for yourself or your loved one. But again, it's important to get a good match and have a good fit, which is what I love about Seni too. You have all these guides on how to fit in your leak guards, and you talk people through it, and you train people with your products, why they're different and how important that difference can make. We did a show one time, and I'll just summarize it quick, but we had a gal who had a loved one she was caring for, and every morning was the same thing. She soiled herself, she soiled the bed, the floor was wet, the laundry had to be done, she needed to get thrown in the shower. I mean, you just think of all those things that you have to do, and now you can avoid those.
Yeah.
I mean, that starts your day on a whole different level in terms of your entry point into your day. And those are really important factors. When you've talked about well-being, being continent, it just kind of holds the plant together, and it makes somebody feel stronger to be part of the world, because our world can be kind of cruel, especially when it comes to incontinence. So how do you view kind of that broader picture of comfort and independence and getting back to enjoying, life and things like music therapy?
Yeah. So, great question, Lori. I would say too, as you were mentioning a few other comments, there's a myth out there that incontinence is a normal part of aging. And it's not that it's a normal part of aging, it's a common part of aging, but it's usually caused by another reason. And so when we talk about stigma or embarrassment, number one, what I would say to people, and Dr. Laird may have some advice on this too, is not to be embarrassed to go to your physician and say, I'm having some challenges, because there are certainly tweaks that could be made to, I'm just using some examples, a side effect of a medication. And so if you think about it, if you're too afraid to bring it up, you could be losing out on different activities that could be a simple fix. So that's number one, is to try and look at what is causing this? What is the challenge here? And then as it relates to independence, one of the things that I've learned from Dr. Laird over the years, and I appreciated the insight to it so much, because I think of people wanting to age longer in place in their homes. And I picture, I'm just going to use an example. It really doesn't matter the age, but let's say you have two older adults. They're both 85. They've been married for years. They still love one another very, very much. But one of those folks becomes incontinent, and now the spouse becomes the caregiver. And maybe if that person makes a tweak in a house, this is from you, Dr. Leah, but I use it all the time now as an example. If I always slept to the left of the bed and my husband always slept to the right of the bed, and the bathroom was closest to where my husband lies, we're used to that habit for X number of years. But if I know that I have to void, but my legs just don't work so well, we could simply switch sides of the bed, right? Now I'm closer, and that could get me to the bathroom sooner, versus if my spouse now has to help me at night, change my linens, change my garments, wake up with me frequently. What happens now is you have the loved one that you're caring for that can have decline due to incontinence, but you also now have the caregiver that's declining, and they may get to a point where they say, I love my spouse. I can't do this anymore, though. I can't do this anymore. And so they may look to transition their loved one into a community. Whereas if you rewind and you have a good quality product that lets you sleep through the night uninterrupted, not just the person who needs the product, but the caregiver, the spouse, you can actually keep couples together longer, aging in place at home. And the same would apply for if I'm the adult daughter and I'm caring for mom or dad in my home, I may still work. If I have to get up to help mom, I'm going to do it, because that's what we do. We do it, but I'm going to help. But I now don't have sleep. And now I may go off to work, and it may show in other things towards my colleague, towards the role that I'm trying to do. It could lead to resentment. Now I'm tired. So again, if we rewind, incontinence and managing it can be the root of so many things, but more education is needed, getting to your broader, question and the bigger picture of how do you keep it all together and independence. It's really about learning what makes, number one, improve continence care whenever you can to some level. But then from there, if you need something, it's about learning what type of product should I be wearing? How often should it be changed? Those types of things. What are the features? Full breathability, inner leak guards, soft, comfortable material. All of those things come into play. So I think the answer, long story short, is education, education, education.
That is so true. I remember my dad lived with us for a while. He had gotten in a car accident, and after a week, I just went into him crying. I slept not at all for a week, and he would not wear a brief. We had a little portable toilet next to the bed, would not use it. He wore his boxers, and then he had broken his arm in a car accident, so he's having a hard time, maneuvering stuff. And so the bed was wet, the hardwood floors down the hallway, my tile in the bathroom. So, and every night, sometimes twice a night, I was changing everything, I was cleaning everything, and then you start your day. And I had the privilege of being able to take off work and just have my team do my work. So I was lucky. I didn't have to go to work. And I just like, Dad, I can't keep doing this. I can't. Plus, you're going to wreck my house. And then I was feeling resentment for that, and so it was really tough. And then he finally worked with us to make things work. If we can have these conversations ahead of time to let somebody know this is difficult on you and your dignity, I get that, but it's hard on the caregiver because they're seeing you struggle and they want to support you. And now, if you're having accidents, the amount of time and the cleaning and the doing the wash and, all the getting them cleaned up, it's so draining. It's so draining. So being able to have honest conversations of how do we, and I don't care if it's dementia or whatever, how do we support one another if we do get ill? Everyone looks at how are we going to support the person who is ill, but we also have to look at how do we support those that care for us, if they're our loved ones or if they're in a community, because it makes a difference in terms of how we are going to interact with them. I mean, if we're exhausted, we're not our best selves.
Right.
And that's not who you want caring for you.
Yeah.
You know?
So true. I think as a society, systemically, we need to just breathe, slow down, breathe, and give people the gift of time. Because I think when we stop and we just breathe with people and give them time to figure things out versus rush, 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 you have better outcomes, better connections, and everybody fares better, I think.
Dr. Laird, I want to pull you into this conversation from a medical perspective. I'm sure you have families that come to you that are ready for this kind of conversation when a diagnosis hits, but I'm sure you get a lot of them that aren't ready for that conversation either. So how do you talk to them about still treating somebody through that whole person lens, keeping the dignity and the relationships together?
Yeah, thanks, Lori. I do think it's quite a challenge because every family comes with a different lens of what they're seeing in their loved one. To Alexis's point earlier, one patient is one patient, and then the family around them, everyone's unique and different. And so one size doesn't fit all. And from a medical perspective, we're really good if there's a very clear-cut disease process going on that has a clear-cut treatment and a clear-cut way to resolve the symptoms of that while we're treating them. So you come to me with an infection, I know the antibiotic to choose, and I can give you a fever reducer along the way. You're going to feel better. Great. The medical model did its thing. Alzheimer's disease and all of those dementias, we don't have a full treatment. We often don't have ways to make the symptoms less distressing to the patient as well as the individual helping this person, either deal with the symptoms or adapt to the symptoms. So that perspective of your medical team having a whole person sort of focus, that's also not universally available. So one thing for the caregivers out there is there often are, primary care providers who are helping families facing this illness. Some people have memory care specialists. And hopefully between the primary care and the memory care specialist, you can find some assistance for the sort of associated issues that really represent that whole person care. So ideally with Alzheimer's care, you are looking at, to Deanna's point about someone who's incontinent at night and doesn't know the way to the bathroom, even in their home of many years, requiring the husband to wake up. Ideally, the memory care specialist team would help with that, but not necessarily. But maybe the primary care team can, or maybe it's an occupational therapist who comes to the home and sees the setup and is able to look at the physical plant in that physical setup in that home and help you out. So caregivers sometimes have to be the ones to, ask for that whole person care. How can we as a family address this symptom? Because there will be limits to what you get from the medical profession, so to speak. So I think that's one challenge that I see. But I appreciate the examples that have been given today, especially around urinary incontinence, because even with early stage dementia illness, you can lose the planning ahead, for example, that it might take to realize that if you were leaving your apartment to go to lunch in the dining room, shared dining room, right? There's going to be 5 or 6 other ladies there to have lunch with you. If you lose the executive planning early on with your Alzheimer's disease, you may not remember to go to the bathroom before you head down to the dining room. And then you've got embarrassment if an episode of urinary incontinence happens because the line at the bathroom was too long when you got down there. And that's a setup for someone to no longer want to go down to the place where they get their nutrition and their socialization. And so that's another example of, the whole person care for someone with these illnesses, these dementia illnesses, really needs to look at not only the symptom, but what is the effect of the symptom on their day-to-day life. And then, work to make the environment around them more supportive of being able to help those individuals. And that's a challenge again, but for those caregivers who are looking, the Medicare Guide program is a relatively new program that Medicare has available now, where using your Medicare insurance, there are what are called care navigators assigned to families that are helping a loved one with Alzheimer's or other dementia diagnosis. And sometimes those navigators can add some of that whole personness to the overall care plan, that the medical doctor will cover some of it, therapists can cover another, and these care navigators can add to it. So that's one important, progress that's been made as far as medical care that's available.
Yeah, well, and a lot of times when people get a diagnosis like this, they're depressed, which music can help pull out of that. Or if they're incontinent, people get depressed too with that because they don't know their options. So again, it's having these conversations. When you had mentioned about not being able to, kind of get rid of symptoms, one comment I'm going to make, because I don't think this is known enough, and I don't think people test it enough, is, I've done a lot of interviews with people on our Dementia in the Arts program. And what they say is, and it doesn't make any difference what kind of art, if it's music, if they're writing poetry, if they're painting, if they're using a 3D printer, they're doing a play, they all say when they get in the zone, their symptoms melt away. And we are so trained to, they can't learn that, or they're not able to do that. Well, let them try. Their ego has gone, so they're probably not as paranoid as they used to be, as the disease progresses, of what other people think. And so that makes a big difference in our ability to try or find joy in something when we don't have that hanging over us.
Well, one thing Alexis touched on that I'll amplify is the benefit to the brain's overall health from music therapy and from an experience with music. I guess I should put it that way. And there definitely is evidence that the real negative to our brain's health, even for people with a disease like Alzheimer's disease, you can make your environment of your brain healthier or not. You can have too high of blood sugar, you can have too high of blood pressure, cholesterol, but stress, that emotional stress, or too many things coming at you all at once, that's going to reduce the ability to be cognitively sharp. So what I believe the data shows us is that music and that sort of salve, if you will, on the brain has an ability to reduce the release of the stress hormones that are so common with those other sort of conditions. And with the reduction of those stress hormones, you actually sort of clear things out. And even someone with a dementia illness is going to have better performance if the rest of the environment of their brain and the environment around them is optimized. It's kind of like when you go to take a test or something, you want the room quiet, you want to be able to focus. You don't want distractions of any sort. That's like making the environment around you top notch. Our loved ones with Alzheimer's disease and those illnesses need the same thing. And music therapy, I think, is a wonderful way to improve the environment around and really show people that they can have that that ability ongoing, and feel for a certain amount of time, relief of symptoms and improved quality of life. So I think it's a terrific opportunity that we all need to add more to our care plans.
Well, exactly. And that movement piece is important too, because if people are sitting or laying too long, circulation's not as good. You can get bed sores. I mean, it goes on and on and on, and everything is so interconnected, and we don't always look at it like that. But I think it's really, really critical that we do. What advice do you have for caregivers who are feeling overwhelmed and just out of balance, trying to be in balance, caring for, themselves and others and their household and work and whatever it might be?
Well, my first answer is to accept the fact that you can take your oxygen first. So that that saying is really important. Give yourself the liberty to take your oxygen first and make sure that you are solid for your loved one and for yourself and whatever other responsibilities you have. So, and I don't know if Alexis is going to like this next one, but it has a music therapy sort of connection. So one of my favorite examples of how to relieve stress as a caregiver, I try to share things that come from other caregivers, because I've told you I don't have a personal experience, so I'm being a conduit from others who do. So one of the favorite ones, Alexis, is I have more than one person tell me that they go outside, sometimes in their car, and their windows up, they turn on the radio, and they just either scream out loud or they sing really loudly to their favorite song, or occasionally they use the radio noise to allow them to scream or curse for a real little bit burst of time. And the idea, of course, is just some kind of, release. But music seems to be an important part of it for a lot of my caregivers. And basically, I tell people, accept that you're worth taking some effort at reducing your stress. And that's not anything you're not allowed to have. But then have a plan to do it. Because if you don't, then it will build up to burnout. So accept it. It's okay for you, take that little selfish sort of acceptance, but make a plan for it somehow. And if it's not screaming or singing at the top of your lungs, find another outlet. So those are my two pieces of advice.
I think that's good advice. Alexis, do you have any advice you'd like to give in terms of wrapping up?
Oh, well, I love all these different pieces of conversations coming together, because as a music therapist, I'm such a big proponent for addressing the whole person. Like, it's not just, the mental, the cognitive. You have to look at the physical, their social well-being, their spiritual well-being, all of that. And with Deanna, it's so important to address the things that will make them more comfortable to then be able to participate in basic care needs so that they can thrive in other ways. So I just love this conversation. Thank you, Deanna and Dr. Laird, so much for bringing your expertise to it.
Wonderful.
Thank you as well.
Dr. Laird, did you have something else to say?
No, I just wanted to thank Alexis as well. I think it's great for all of us to learn more about her field. We need more of it.
Deanna, any last tips from you?
I want to agree with Dr. Laird with thank you, Alexis. I continue to learn so much from you, and Dr. Laird, always fun. I've missed you. It's been a little while, so glad to see you and Lori. But mine would be, I've learned over the years, in my opinion, is instead of thinking, let's have a good year, let's have a good month, let's have a good week, let's have a good day, let's have a good afternoon, to really kind of pull back for both the caregiver and the loved one to say, what can we do today to have a little bit of joy? And if we can do that today and we get up tomorrow, let's try and have a good day. So mine would be breathe. Hopefully people have a big network of support. I have a lot of empathy for caregivers. Try and make it a good day or a good afternoon or a good pocket of time versus because you can get caught up in a big black cloud. I call it sometimes, because if you're thinking too big picture, this scenario that just happened now is going to last forever. With people with dementia, you don't know what tomorrow looks like. So, hey, maybe we had a challenging day today, but we had a great day the following day, or vice versa. So I think just make it a great day as best as possible.
And Lori, if I can add one more thing, I loved your example of the couple who danced in the morning and danced at night. And then you also talked about songs in the shower. And so it just gets me thinking. I feel like asking Alexis, we can kind of create a soundtrack for the day. And to Deanna's point, a soundtrack for a good day could be a terrific, way for caregivers to kind of start helping themselves, since that music is going to be so beneficial to both them and their loved one.
Caregiver might want some heavy metal to sing to.
You never know. That's right. That's right.
One of the things that stuck out to me too is we talk about whole person, but I would really like to in some ways see us look bigger than that and look at the team. It's got to work for everybody or it's just not going to work. If we aren't authentic in stepping into our care, the person we're caring for can read that. And they can feel that they're a burden without us even saying anything. So I think it is really important to kind of, like Deanna said, break down the picture. And it might be just a second or two of joy. But, as the disease progresses, that embeds in your heart and stays with you forever. It's those small little things. So I think really taking into our multisensory connections and appreciating those. And we can only do that when we slow down. And really, because sometimes it might just be sitting with somebody silently. But I love the ideas of the cues for, the music throughout the day. And it might be cues like Dr. Lord was saying, maybe you have to go to the restroom before you leave to go to the activity. Maybe there's music for that, music, to just remind them to go to the bathroom. Or, we didn't really talk about, even with incontinence, monitoring how much someone's taking in. If we're not paying attention to that, that's going to be an issue that a lot of times, we can work with. So I think it's really looking at that big picture and not feeling alone, and then being present enough to not be overwhelmed with the loss that we feel and that they feel when this disease hits, and not being so scared by what could be coming down the road. Because when we're living in the past or projecting in the future, we miss the moment in the present. And that's the only place we can identify joy or create it. And so if that's our goal, we got to walk into that. We really have to embrace that. And I'm not saying that it's not healthy to grieve, because it definitely is. And I'm not saying don't plan ahead, because you do want to. But bottom line is, none of us can control this. We can just do the best we have with the information that we have in the moment. And that's always going to be adjusting. And so we have to get used to being flexible, and we have to really be looking at the signs that are right in front of us that have never gone away, but we've gotten so used to relying on just words that we're not picking up what the needs are within the person we're caring for, or even within ourselves. What a great conversation. I want to just have each of you, if you don't mind, give out contact information for yourself. Now, Alexis, do you want to go first? And you also do stuff online as well as in person too.
Yeah, so Bridgetown Music Therapy is my company. The website is bridgetownmt.com. That's kind of our hub for everything, getting in contact, learning more about the benefits of music. And so I offer services locally in the Portland area, Portland, Oregon. But then during COVID, I created an online program. I don't call it formal music therapy because it's not that formal approach, but just took my years of experience working with people in person and put it in video format into a program that's accessible anytime. So it really is a valuable tool for caregivers because, once again, if you don't know where to start, it's a great starting point. It's super accessible because it's online. It doesn't involve scheduling, super affordable, high quality, and just lots to choose from. It's a video library of over 350 videos. So I encourage people to check that out, to take advantage of our free trial and just give it a try and see if it works for you and your particular care setting. And my email, if you want to reach out directly, is alexis@bridgetownmt.com. Also get in contact with us from our website.
Okay. And you're on Facebook and Instagram
Yes.
and LinkedIn as well.
Yep.
Dr. Laird, how about you? Was there contact information you'd like to give out?
Sure. My email for my practice is rlaird@mymemoryclinic.org. Now that's my private practice right now, only for residents of the state of Florida. It's all telehealth. It's memory specialty care that we do. And we are a guide provider. I was mentioning that Medicare's new program for guide care navigation along with the medical care that you're used to getting from a memory care specialist. So.
Okay. And then I believe you're on Twitter and Facebook and LinkedIn as well.
A little bit.
A little bit? Okay. Yep. You're out there busy helping people individually. That's quite all right. So,
I'm at the clinic most of the time.
okay.
So.
Sounds good. And Deanna, what contact information would you like to give out for Seni?
Yeah, I think our website is a great resource from an educational perspective. So that is www.seni, S-E-N-I, and it's a hyphen, USA.com. And we do offer free product samples. So if people go to that website, not only can they explore a lot of educational resources, but they can also click and have some free samples shipped if they need them. For any communities that are interested in a product trial for any residents, I can be reached easily on LinkedIn. My email address is a mouthful, so I'm almost a little hesitant to give it out just because it's a lot to take in, but it's Deanna, Deanna Vigliotta, V as in Victor, Igliotta at TZMO. I always say Tiger, Zoo, Monkey, Ostrich, USA.com is my email with the company as well.
Okay, sounds wonderful. And you also have a podcast, your Continence Chats and YouTube channel, and are on Facebook as well. So
Correct.
Lots of ways to be able to hunt these gals down and tap into their resources and their brilliance. Thank you all for joining us. I always ask our audience to be a giver of hope, like, click, and share, not because we're watching the numbers, but it's because we know you have people in your sphere of influence that need this information. Costs you no money. It takes very little time, but it means a lot to families in need. Last, I'll just give a shout out to a couple of websites that we have that have tons of free educational resources for you. One is Alzheimer Speaks. Just go to our free educational resource section. There you will get videos and audio and tools you can download, all kinds of things. And the other is going to dementiamap.com. And again, that is free to use. So thanks again, everybody. Have a brilliant week. Bye now.